This is Dr. Steve with Rockwall CPR. Bleeding injuries, factories, distribution centers, places of work that are more likely to have these types of injuries. I presented at dozens and dozens of these types of facilities and unfortunately have yet to see even one be properly prepared for a bleeding injury. So, what kind of supplies should you have? Because there's just nothing like being trained and having the proper supplies so you can effectively and quickly stop a bleed. Here is a short list of proper bleeding supplies. So, number one, a tourniquet. Does your place of employment need a tourniquet? Has your workers' comp statistics? Look at them over the last bunch of years. Has anybody ever needed a tourniquet? Could you possibly have an arterial bleed due to an injury due to the type of work performed at the place of work or out in the field? If you're going to prepare a bleeding supply kit, then a tourniquet is obviously the product that you're going to use in the worst case scenario, as in that arterial bleed, as in a God forbid amputation of an arm or a leg. So you need to have tourniquets. What type of tourniquet? There's something called the Committee on Tactical Combat and Casualty Care. They have rated different types of tourniquets. You can take a look at the link in the description box for the tourniquets that are rated to be excellent by this committee. And that's the type of tourniquet you should purchase because they are proven to effectively stop the bleeding. So a tourniquet would be number one. Number two, and frankly, I've never seen this in a kit at a facility, is what we call hemostatic gauze. In other words, a simple gauze pad that has the hemostatic, hemo for blood, static for stop, has the hemostatic agent embedded in the gauze. So when you rip the package open, you're placing a gauze pad. You, of course, apply pressure because that's what you need to do with a bleeding injury. You're going to apply pressure, but instead of a plain gauze pad, it has the hemostatic agent in it, so it's going to stop the bleeding much more quickly. These products are tremendously effective, and I have the links to all sorts of different products. You can decide which product might be the best. They typically come in 3 or 4 inch wide and 2 to 4, even 6 foot long pieces of gauze. So you can take the whole piece kind of like an accordion and just place it on the injury, or you can wrap it around like a typical rolled gauze. Either way, it works. It really does work. And that would be my go-to product for most workplaces because many of these bleeds are bad enough to need the hemostatic agent, but not bad enough to need a tourniquet. So if you cut off the end of a finger, having a piece of hemostatic gauze and wrapping it around that finger quickly will stop the bleeding. These products work. Other types of products, a product called Rapid Seal Wound Gel. This is a gel that comes out almost like a glue. And if it's a fairly bad cut, you can place it on that cut and it will seal the wound. And these things really work well. 4x4 gauze pads. Don't waste your money with smaller gauze pads. Just get at least 4x4. If you want 6 inch by 6 inch, have gauze pads ready because the first thing you're going to do is apply pressure, and you need a decent sized gauze pad even for what looks initially like a small cut. Apply some large gauze pads to the wound and apply pressure. Then you can have rolled gauze. So if you have gauze pads and you've applied pressure, then you get out the hemostatic gauze, put that on, then you can put the rolled gauze around that to secure it. And voila, you have a way to stop the bleeding. Now, for finger cuts, there is a really great finger cut kit. So, if God forbid there's a really bad cut or even an amputation, this will slide on almost like a super tight wedding ring or ring, and it will cut off the blood supply in the finger as opposed to putting a tourniquet further up into the extremity. And these are very effective and they do work. So, you're at a hair salon, you're working at a drill press. You're working with saws, any type of equipment that could sever a finger. These finger cut kits really work. Why wouldn't you want to have that at your workplace? Nitrile gloves goes without saying, but we're going to say it anyway. Having gloves, critical. You must be wearing gloves when you're stopping bleeding. You may also want to have more things like eye protection and even face protection as well, but at a very bare minimum, having gloves. You never want to touch blood without gloves on. Trauma shears, something else. You may need to cut clothing. You need a proper pair of scissors. One of my biggest pet peeves, crappy scissors in first aid kit. The plastic little teeny scissors that you can't even get your fingers in. For crying out loud, get yourself a pair of 8-inch proper trauma shears, and you will be able to cut through anything that you need to cut through. And then, of course, you have the self-adhesive bandages or tape, which you can put over that rolled gauze and really seal everything up. So now you have a gauze pad that you're going to stop the bleeding with, or at least slow it down. Then you're going to place the hemostatic gauze on that. You may place some rolled gauze over that, and then that self-adhesive tape. So you wrap it up, and you can apply pressure even with the tape, and voila, you are able to stop the bleeding. So please check at your workplace. Please check the bleeding supplies. If you have any questions, contact us at Rockwall CPR, and we'll help you prepare a kit so you have the proper bleeding supplies to deal with any of these types of injuries. rockwallcpr.com.